Shantelle Leatherwood, thank you for joining us on this live edition of the Extra Podcast. Shantelle is CEO of Christ Community Healthcare Services, and here today, obviously, to talk about y'all's essential role in the response to COVID-19 coronavirus. Talk about what all that Christ Community is doing right now to help fight the disease.
All right. So, of course, the coronavirus caught us by surprise, as it probably did a number of healthcare entities here in Shelby County. And so the weekend that the first case was diagnosed, my executive team, along with other leaders across the organization, we met that Sunday that the case was announced to talk about our plans to start preparing the organization for just this pandemic and how we would actually treat our patients. And by that Tuesday, we had decided that we really needed to offer drive-through testing to our patients as well as to the communities that we serve. As you may be aware, Eric, that we have 8 locations here in Shelby County. They're all in underserved areas across Shelby County. We also have a location in East Jackson in Madison County, which is also in a medically underserved area. And we thought, who best to meet the needs of the community and make sure that we were eliminating barriers to care and ensuring that those who lacked primary care or any type of insurance had access to testing. So we stood up a drive-through testing location at our 3rd Street Health Center on March the 21st. And that particular day, our goal was to actually test 50 individuals. We tested 49 individuals that particular day. Since then, we have been running that drive-through testing site Monday through Friday at the 3rd Street location. We've expanded to our Hickory Hill location. We've also expanded to our Fraser location. This past weekend, we had a drive-through testing event in conjunction with the state of Tennessee, and Governor Lee was actually at that event. We tested 487 individuals this past Saturday from 11:30 until about 4:50 p.m. And they actually had me working out there, Eric. But it actually was a lot of fun and took me back to my early days, kind of in healthcare, working at the front desk and things like that. But so 487 individuals Saturday. In total, we have actually tested over 1,700 individuals. We have found 101 individuals to be positive. We're currently providing follow-up care to those who lack a primary care provider, or if they were an existing Christ Community patient, we're providing follow-up care to those patients via telehealth. We're preparing actually this week to expand to our 2nd full-time drive-through testing site in Hickory Hill. And then we'll be offering testing at the end of the day at the remaining health centers.
And so
that's what we're doing.
Wow, you're doing a lot. Is the testing you're doing, I assume, is it free, I assume?
It is free
okay.
Currently. We haven't really figured out how to bill for it. Of course, COVID-19 is so new. The drive-through testing process is very new. So what we call CPT codes and diagnosis codes, it hadn't really caught up. So everyone is trying to figure out how to bill for the services. But for us right now, we just want to offer the care to the population to make sure that, number one, that we're quarantining those individuals who are positive. And then number 2, that we're reducing some of the disparities, especially amongst AfricanAmerican communities, that they're receiving the test, and that we're preventing hospitalization. So our goal is to try to prevent an individual from going to the hospital if possible.
And so many things to touch on there. The testing, are you doing only people with symptoms, or is it anyone at this point?
So we're working in collaboration with the health department, and essentially they have said to us that we can test anyone that has flu-like symptoms, even mild flu-like symptoms. So that would include someone with a fever, a cough, shortness of breath, loss of taste and smell, diarrhea is actually on the list. I'm trying to think of the others now. Sore throat would be the other one.
And I assume everything's on your website, or is there a phone number people can call?
So everything, yes, is on our website at www.christcommunityhealth.org. If individuals desire testing, they can actually text us at test2020 to 91999. Did I say that right? 91999, yes.
Okay, and and they need an appointment, I assume. I think the drive-through kind of implies you can come whenever you want, but I believe you all prefer an appointment.
We prefer an appointment, and that's just to make sure that we can prepare all of your files and documents prior to coming to the testing site. Our goal is to be as efficient as possible, and we don't desire that anyone have to wait in that line. So essentially, we have been able to test between 100 and 120 individuals in an hour and a half. This Saturday's event was a bit different because we were working with the state, and it was no appointment, no symptoms. It was testing everyone that showed up. So that took a bit of time.
For people who showed up who didn't have symptoms, did you get a sense of why? Were they just worried, they read, they felt like they just wanted to know? I mean, what were the compelling reasons people had? I can imagine there are many, to come get tested if they didn't have symptoms.
Well, that's the unfortunate piece of the drive-through testing, because you don't interact that much with the patient. We're encouraging them to stay in their cars with their windows rolled up, and then we're talking through, we're asking screening questions, but not delving into the reasons why they're wanting to be tested. I can say for those individuals, for a number of the forms that I actually reviewed, some that had no symptoms at all, they were either in contact with someone who was diagnosed with COVID-19 or a healthcare professional, or in close proximity to someone over an extended period of time.
Gotcha. Are you all doing contact tracing? This term that we're all learning, contact tracing, where anyone who does test positive, then the best practice that lots of people are talking about, and the CDC on down, that you need to get in touch with that person and then figure out where they maybe got it, talk to the people they've been in contact with. That's one of the key things about kind of mitigating the spread of the disease. Do you all do the contact tracing, or do you hand that off, or?
So it's twofold. So number one, the health department is responsible for doing that contact tracing. However, as a primary care provider, we start the conversation. So when they actually come through our drive-through testing site, we ask them to begin to document the last 10 individuals you've had contact with, because if they're positive, they need to be prepared to share that information with the health department. So when we call them for follow-up care and we share that you're actually positive, then we go through education, and then we ask them who is in your household, who have you had contact with. You need to encourage all of those individuals to come in for testing. And we've actually seen that to occur several times. We've actually tested someone, and then later the entire family has come in and they've all tested positive for COVID-19. Mm-hmm.
Really?
We've had a family up to 5 individuals in the home.
Yeah. So many. Every time I have so many questions. Your capacity. Let's go back to that. We had Scott Morris from Church Health Center on last week. They, by and large, are not reaching their capacity, and that has been the case in a lot of places in Memphis, that they're not hitting their capacity yet. Are you under capacity in terms of, or are you maxing out your testing every day?
So we're not maxing out our testing. Our capacity is 200 tests per day. And again, we're averaging somewhere between 90 to 130 patients a day in terms of testing.
What do you think stands in the way of that? Why aren't more people coming to get tested?
So number one, I think it's education. So over the last 2 weeks, we've actually seen an increase in testing. And that's because we've taken more of a grassroots approach in terms of educating the community regarding testing. We've sent text messages to our patients. We've targeted zip codes of patients. We currently serve over 56,000 patients a year. So we're looking at each zip code. If we're going into that zip code, making sure that we're sending out targeted messages to those individuals. And then we're also sending flyers and communications to community organizations, to churches. We're trying to partner with churches. We've sent communication to the county commissioners so that they could disseminate that information to their constituents. And we've seen an increase in testing as a result of that. I think the other piece is the limitations in the screening based upon the symptoms. If I look at and compare what we actually did this Saturday to what we've done on a daily basis, I think actually requiring an appointment is a limitation. So it was much more effective for individuals to kind of drive up and be tested and not have to confirm an appointment. And I can understand the change.
Will you make changes to how you do your daily testing based on that? I mean, will you open that up to non-appointment testing?
That's a good question, Eric. So we're talking about that. We talked about it today. My team would kill me if I said, "Oh, sure." They would actually kill me.
I don't want to get problems. So.
Yeah. So, based upon the direction of the health department, we'll adjust our screening protocols if they say to us, now we're shifting to asymptomatic testing. We may consider relaxing the need to have an appointment because we've had individuals to drive up to the testing sites and because they're trying to be tested, and we've adjusted and added individuals to the schedule. So we've become pretty efficient at that as well. It's just doing it on a large scale. It just takes a significant amount of coordination.
Well, I have more questions, but I want to take a quick break and remind everyone that this podcast is brought to you by FedEx. Possibilities, what we deliver by delivering. We are doing these live right now with video just through the coronavirus, but they are fundamentally podcasts, the Extra Podcast. It's available on the website. It's on iTunes, Spotify, or wherever you get your podcasts. We also have podcasts going on. It's a politics podcast. Jennifer Biggs is doing a food podcast. In normal times, we do sports podcasts as well. Those are by and large on hold right now. So let me go back. Well, again, I know there's been some talk about more mobile testing because that, I mean, obviously not everyone has a car and public transit is, maybe not running full speed now. People don't want to get on a bus. I mean, there's just so many factors. And so is there an ability or a need, I guess I should start there, to do more mobile testing and in more locations?
Yes, there is a need. So again, we're working with the health department to identify areas of priority. We're looking at zip codes that do not have a high rate of testing, but could also have a high rate of positive cases. And so, we actually have a COVID-19 safety net healthcare providers collaboration, and it includes all of the federally qualified health centers across the city, as well as the charitable care clinics. So Church Health is a part of that. Memphis Health Center is a part of that. Tri-State, Cherokee, as well as case management and Memphis Health Center. I can't remember who I've included. UT is a part of that as well. And so based upon our availability, we may make determinations to go out to a particular zip code to do some pop-up testing. Right now, Church Health has the most flexibility to go out to specific zip codes to do some of that testing. If we know that an area is a hot spot, then for those FQHCs that are in those areas, we may say to them, can you expand testing in your area? So for instance, in zip code 38118, we know that there is a community, a mobile home community that had over 170 cases within the community. Clearly a hot spot. And so that is the next area that we have prioritized. A week or two ago, the priority was Fraser. So now we've had several events in Fraser over the last 2 weeks as a result of that.
You talked about we've been writing about it at Daily Memphian. The COVID is hitting African-American population hard, disproportionately. Your sense of why?
That's a good question. My sense of why. I believe a couple of reasons. For African-American populations, number one, we tend to have multiple comorbidities or multiple chronic illnesses. We have a high rate of diabetes in our population, high rate of hypertension, which decreases our immunity and our ability to fight off viruses. And so that's one of the reasons, one of the causes of the high rate of the virus within our communities. The other one is for some of our communities, they're very dense, and people are living in close proximity to one another. So we're also actually seeing, not only in African American communities, but a high rate in Hispanic populations as well. At least for Christ community, that's what we're seeing. So if they're living in close proximity to one another, several individuals in the household, then they're more prone to actually spread or transmit the virus to one another. So it's highly important for us to go out and test individuals in those communities, again, eliminating barriers, taking the testing to them. And because of those chronic conditions, they also have a high rate of death in the African American community.
Yeah.
Probably, Eric, I would say it's probably one of the things, because of course I'm African American, and I grew up in 38106 here in Memphis, and it's probably, I wouldn't say one of my prime drivers, but one of the drivers to make sure that we're doing everything we can through our health centers to target the communities that we serve. I don't want to see my people dying from this particular virus.
Yeah. The effort by the mayors on Monday, as we're recording this, announced the plan to begin incremental reopening, right? The 2-week kind of testing, looking at numbers, seeing where we are in terms of the rate of cases and positive tests, and limited contact in restaurants and some what up till now been non-essential businesses more allowed to open with distancing measures in place and so on. Do you have a sense or an opinion? I mean, what that will do to the caseload, to your work, or will you just kind of receive it as it comes?
So that's a good question, also, Eric.
I try.
I'm trying to think of how to answer that question. So, of course, we're working in collaboration with the health department. And so I think one of the charges for Christ community is to, number one, ensure that we're providing testing. And we're doing so at a rate to supply the county and the city with the data necessary to make wise decisions about whether to reopen the city, when, how, what that time frame looks like. What they have said to us is that we should be prepared to test through the end of September into October. They've also shared with us that COVID-19 could possibly be around for the next 2 years, and that it will come in phases. So we're currently in phase 1. Phase 2 may occur sometime in the fall during the flu season. And so we're all preparing to continue testing for the next year or the next 2 years. Testing might look a little bit different because we may shift to antibody testing to determine individuals who might be currently immune from the virus. And it's really probably most effective at identifying those individuals who were asymptomatic but had the virus, and they're now currently immune to the virus. So I think my response to that is that as a frontline primary care provider in the communities, I want to make sure that we're doing everything we can do to support the health department, to supply them with the information they need to determine the best course of action for the city. I will say, just going back to I'm African American and my people, I don't want to see our people impacted or even the rate of death or the number of cases or the rate of death going up because we might have opened too soon. So anyway, I am driven to make sure that we provide as much testing as we possibly can. And we've developed a plan for the next 8 weeks to expand testing to about capacity of 1,600 tests a week.
That Christ Community will do. Wow.
Mm-hmm.
Yeah. Where are you doing them with one specific lab or multiple?
We are. So we're sending our labs to Popular Healthcare here locally in the city of Memphis.
And they should be able to handle the full 1,600? That's the plan?
Yes. Okay. They have shared with us that they can perform 1,000 tests per day.
Okay.
Yeah.
Back to this process of reopening. I mean, the level of, it would seem to me, I mean, just as somebody just reading about this and talking to people like you who actually know what you're talking about, there's going to be this need for a level of education and communication. Like you talked about 56,000 patients and texting and targeting, that if you as a person have pre-existing conditions, even though the restaurants are reopened, even though certain places are reopened, you got to you really got to target those people and talk to them about how much higher risk. It's not a little bit higher, the early data seems to show, but dramatically higher for people with diabetes, for people with underlying health conditions. It's apples and oranges between two people standing next to each other.
I think you're exactly right, which is honestly why we've kind of shifted to this grassroots approach, is to target our communities, our patients. And you bring up a good point about reopening and really saying to those individuals, targeting those high-risk patients within our database, say, you really still need to take all of these precautions when you go out. Continue to practice the social distancing, continue to wear masks, continue to have hand sanitizer on hand to make sure you wash your hands. If you do have symptoms, even just what might appear to be seasonal allergies, you still need to quarantine and isolate. And just stay away from large groups. No groups larger than 10 people to keep yourself safe. I mean, even this morning we were just talking about just services to our seniors and the elderly population, and we've shifted to providing telehealth services across our system of centers. However, elderly individuals tend not to utilize video conferencing, number one. So we're trying to think about, well, how do we keep this population safe? Do we bring them into the clinics? There's an argument about not bringing them into the clinics. So what do we do with this population because they're high risk as well.
It's very difficult. It's very difficult.
Yeah.
These issues. That unfortunately is all the time we have right now. We will get you back on, I am sure, in the weeks and months to come as this whole situation evolves. Shantelle Leatherwood, CEO of Christ Community Health Services, thanks for being here. I appreciate it very much.
Oh, you're welcome, and thank you for having me.
And we, again, as I mentioned, we had Scott Morris from Church Health Center on last week talking about some of these issues. And Mayor Jim Strickland was on last week, and come on Behind the Headlines. Coming up this week on Behind the Headlines, Doug McGowan, the Chief Operating Officer of the city. Thank you for joining us. And again, stay tuned for more.